Walter and Jalen are twin brothers in college. Jalen is an exercise science major who plays soccer. Walter is a computer science major who mostly plays video games or works at his desk. Let's spend a day with him. At 6 a.m., Jalen has a pre-workout snack of a banana with peanut butter and a protein shake. He goes to the gym for an hour. Afterward, Jalen comes home and makes 3 eggs with toast. At 10 a.m., Walter wakes up. He plays video games for a few hours. At 1 p.m., he gets 2 donuts and a coffee and goes to class. After Jalen's class, he does some work and drinks a protein shake. At 1 p.m., he cooks chicken and brown rice with assorted greens. At 2 p.m., Walter gets soda and chips at the vending machine. Jalen jogs to his second class of the day. After class, he studies for his exam with a snack of apples and veggies. Once Walter is done with class, he heads to the dining hall with Jalen for dinner. Walter grabs 2 slices of pizza and pasta with butter. Jalen has salmon with quinoa and broccoli. After dinner, Jalen goes to soccer practice for 2 hours and comes home, going to sleep by 10 p.m. Walter procrastinated and played video games for several hours. Later, while working on homework, he has a Mountain Dew and a pint of ice cream. He stays up until 1 a.m. to complete it, then games on his computer, sleeping at 2 a.m. Now that we've followed them through a day in their lives, let's look at the health implications of their routines. When looking at their carbohydrate intake, Walter's diet mainly consists of simple carbohydrates. Diets high in carbs cause excess glucose uptake, leading to extra glucose being converted to fat. Simple carbohydrates are high on the glycemic index, causing spikes in glucose and insulin levels because of the quick and drastic rise in blood glucose. This is called insulin dumping and causes sudden fatigue and increased food cravings, which may explain Walter's frequent snacking. This cycle puts Walter at risk for developing insulin resistance and type 2 diabetes. Long-term issues include damage to the cardiovascular system, nerves and kidneys, increased risk of heart disease and stroke, and skin conditions. Walter doesn't consume much fiber in his diet. Fiber is important to help rid the body of toxins and promote weight loss. Jalen, on the other hand, has a diet full of complex carbohydrates. These foods such as quinoa, apples, and veggies have a low glycemic index, meaning that insulin is released proportionally to his blood glucose. Also, Jalen eats adequate amounts of soluble and insoluble fiber, supporting digestion, decreasing his cholesterol, and promoting heart health. Moving on to the implications of their fat intake, Walter's diet is high in saturated and trans fats. Because of his high consumption of trans fatty acids, his low-density lipoprotein is spiked and he has a high risk of heart disease. Walter consumes a high amount of omega-6 fatty acids from processed foods, increasing his risk for cancer from chronic inflammation and oxidative stress. Walter has an increased risk of developing obesity because of his increased fat storage as a result of his diet. On the other hand, Jalen's diet is high in monounsaturated fat and a more adequate omega-3 fatty acid intake, decreasing his issues with inflammation and oxidative stress. By consuming a healthy 4-to-1 ratio of omega-6 to 3 fatty acids, Jalen's body develops the proper inflammation needed to fight harmful pathogens and protect him from infectious diseases. Higher high-density lipoprotein removes excess LDL from the blood and reduces buildup in arteries. Looking into both of their protein intake, Walter's diet has a low amount of protein, causing him to feel constant hunger, increased food cravings, and less satiety. Consuming more carbs and fats to satisfy his cravings results in an imbalance in his diet and weight management issues. His feelings of fatigue increase from having low energy and ineffective metabolism. He has a weaker immune system functioning, leading to more vulnerability to infectious diseases. Jalen consumes lots of protein from his food, supporting muscle growth and repair, especially after physical activity or exercise. He has a lower risk of infection from disease and a more resilient immune system because of more antibodies produced. The balance of his eating choices also causes better weight management and energy expenditure. However, Jalen also takes protein supplements, which may decrease his ability to get all the necessary amino acids. Protein powder is not regulated by the FDA, Food and Drug Administration, and may not be as advertised, posing risks to his health. Moving on to metabolism, Walter isn't active and doesn't exercise. His decreased endurance exercise leads to reduced aerobic capacity and inability to do endurance exercises properly. He can't breathe well and has a greater oxygen debt with weaker oxygen replenishment from a less efficient removal of lactic acid. Buildup of lactic acid causes health issues that will prevent productive exercise. His body has decreased fatty acid oxidation, resulting in lower energy production. Less exercise also leads to the Krebs cycle, relying more on using carbohydrates and less on fats. Jalen's high physical activity and high endurance exercise lead to his body using the Krebs cycle more to boost oxygen delivery and utilization. He burns more fat, leading to more sustained energy regeneration. His increased endurance exercise also results in increased mitochondrial density and aerobic metabolism capacity, allowing him to improve his endurance. Jalen's increased exercise leads to improved oxygen delivery, less oxygen debt, and more efficient lactic acid removal. How can we take the lessons learned from our nutrition class to improve Walter's and our lifestyles? Walter can make better eating choices by increasing consumption of fat-free, low-fat, less-fat, or light-fat dairy products including milk, yogurt, and cheese. Eating fiber can help control his issues with weight, blood sugar, and cholesterol. Eating a banana and drinking a glass of milk before bed can help Walter produce more serotonin, converting it into melatonin. Omega-3 fatty acids improve heart health and reduce inflammation. Plant sterols lower cholesterol and improve cardiovascular health. B3 and purple-skinned fruits increase HDL and reduce oxidative stress. Swapping the amount of fast food he eats for homemade foods instead informs Walter of what he is consuming. He should decrease his intake of high glycemic index foods because of the high risk of spikes in blood sugar and diabetes, saturated and trans fats for their increase in LDL and clogged arteries, and omega-6 fatty acids to decrease the risk of chronic inflammation. To conclude, we suggest eating a balanced diet with complex carbohydrates making up 45 to 65% of calories, lean proteins making up 10 to 35%, and healthy fats making up 20 to 35%. A healthy diet and frequent exercise work together to keep your bodily functioning to its best ability. Good eating choices include the consumption of this balanced diet and severely limiting intake of processed foods, fast food, junk food, fried food, and processed meats. By starting with small changes, it will be easier to ease yourself into it.